Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. I'm excited to share this episode about hyaluronic acid and the treatments available that can improve the appearance, texture, and health of your skin. Joining us is Dr. Eugene Nowak, a popular board-certified dermatologist who practices in Chula Vista, California. Dr. Nowak received his medical training at Midwestern University and completed his residency at the POH Medical Center through Michigan State University, acting as chief resident. He has spoken internationally and performs as preceptor to many physicians, training them in dermatologic and cosmetic aesthetic procedures. I can't wait to hear Dr. Nowak talk candidly about hyaluronic acid and share what you need to know to determine if this treatment is right for you. Hi, I'm Amy, and we are joining you live from the studio today with Dr. Nowak, who is going to tell us all about injectable hyaluronic acid fillers. How are you today?
Great, thank you for having me.
So what are they, and who's a good candidate for that?
Yeah, so fillers have come a long way, and I'm sure most people that are seeing this have heard about collagen.
Right.
And so we got to start there because it was really the first commercial filler that we had. Okay. And it was amazing. It was soft, it was smooth, it was natural, but it didn't last very long.
Right.
And so those patients, 3 months, they're back in, they're like, it's gone. So it was a limited number of people that would use that product. So the hyaluronic acid fillers come around, and it was really a shift in technology because these products now come in different strengths or different consistencies, and each one for me is like an artist's paintbrush. Okay?
Really?
Yeah.
Okay.
So we have an area we need a little thicker brush stroke. We're going to use a little stronger product.
Okay.
You know, we're working on a finer line or something that's a little more delicate, treating an under eye area. We're going to use a softer product there. So we're using different products. So they're hyaluronic acid. So every cell of our body has hyaluronic acid in it. So it is something that's very natural. Collagen, we used to do tests to make sure people were not allergic to it. There's no skin testing required or anything like that.
Well, that's good to
So
know.
we can just take these products and we can use them. Yeah.
Okay. Is there anyone that might not be a good candidate for HA fillers?
Well, I mean, with most people, we can get improvement for them. Now, someone that is looking for a facelift level result, we may not necessarily be able. So if someone comes in, they've lost a bunch of weight, they have a bunch of loose skin, they say, I want everything gone, I want it to look like this. It's like, okay, fillers are not necessarily going to deliver that, but we're all losing volume, okay?
Right.
We're losing collagen 1% per year.
Wow.
Okay. Now, women have the added challenge when they lose hormone, they can lose 30% of their collagen. And I was reading that article, I was like, this makes sense. Because for years, women would come and say, I was doing pretty good, my skin was holding up, and this last year it crashed, it fell off a cliff. And so I'm sure if we looked at their hormone profile, we would see that's what was going on. So we lose collagen. We lose fat where we want it, gain it where we don't want it.
Of course.
Okay. We lose some muscle, and we lose some bone structure. And so we are essentially shrinking. Yeah. And so if you think of parents or grandparents, they shrink a little bit this way, but they're shrinking this way also. So the key is really being able to replace that volume, and we can do it in ways that we couldn't before. So years ago when we first started with fillers, if you had a line or a crease, it's like we filled the line or the crease, and we said, okay, we're doing good.
Right.
You know, but we weren't really creating the youthful balance or that youthful proportion that's been lost. And now we can do that. So we have products that last a long time. So there's products that we can use like in the cheeks that can last up to 2 years. So we give it a 1 to 2 year rating.
Wow.
And the next level of products, we'll give them like a 10 to 18 months rating.
Okay.
And then we have softer products, which are going to be like a 6 to 12 month rating.
Okay.
So long-lasting products. And I literally have patients that we can show you years out that look better than where they start.
I would like to see those pictures, actually. What about the price? Like, I know depending on how many spots that you treat, right? But what is a general
It's really based
cost
on how many
guideline?
syringes we use.
Okay.
Yeah. And so if someone comes in and it just needs a couple, so a syringe could be $400 to $500 for a syringe
Okay.
in our practice.
Would one syringe only treat, like one area, or could you use it all over?
You could use it all over, but we're not going to have the best result.
Okay.
So a great example of that, I had a patient come to me for a consult, and she
Okay.
says, Dr. Nowak, fillers don't work for me. And I said, what do you mean it doesn't work? She goes, I had it done somewhere else, zero result. I'm like, well, where'd they put it? She's like, they did my cheeks, my nasolabial folds, the marionettes, and my lips. And I said, okay, how many? She goes, one. It's like, we solved the problem. It's like she was very deep in here. We put 2 syringes in for her. She called the next day. She's like, this stuff's amazing.
Huh.
Yeah.
So they treated too much, too many spots,
Too
or
many
was
spots.
it?
So it's like
Interesting.
like frosting a cake.
So how many spots?
If you don't put enough frosting on, your cake's not looking good. Yeah,
I see.
You're going to see the cake underneath. So you got to
Okay.
put enough frosting there. So you need enough
Gotcha.
product there. So there's a graphic we like to show that shows a picture with patients with 1 syringe and 2 syringe with
Okay.
3 syringes. And then
Gotcha.
I'll take and show them someone that has 7 syringes. And then we do a technique where we can really shape and contour. And I have people at 16 and 18 syringes.
Wow.
And they look amazing. Yeah.
I bet. So starting around $400, you'd say.
If it was one, so if someone wanted their lips done and say, just want a little volume in my lips, we're going to start with 1 syringe.
Okay.
Yeah, because we'd much rather go back and add a little bit more. These products are technically dissolvable,
Right.
and I can make them go on very quickly, but that's a waste if we do that. So,
Right.
so many times we're starting slower and building up because patients really want to be normal and natural. One of our biggest things is patients come in. I've seen people that don't look normal, and I'll take them through my pictures. I'll say, did anyone that I show you not look normal? They're like, no, your patients look good. It's like, well, all of them had fillers. All of them had hyaluronic
Interesting.
acid fillers.
Okay.
So the filler wasn't the problem. So it was either the person that put the filler in, or they put the wrong product there, or the patient was looking for something unrealistic.
Right. So if someone wants to have this procedure done and maybe they don't have all the money saved to purchase it all up front, do you guys have financing options available?
Yeah, so financing has really been a great option for us because more and more patients are comfortable with financing, and
Right.
many people are looking to do that and really to get them to the full correction or the maximal result. They may need to finance it, but people finance their cars, they finance their phones, they're used to that.
Right.
So it's a discussion or a conversation we have during the consultation. So if someone, we let them know that it is available there. We don't do it directly through our office, but there's companies like CareCredit that do an amazing job of offering that. We can do an application right through an iPad now. Years ago, we'd have a dedicated computer in the hallway, and now with just their phone, they can do it.
Right.
Yeah, so the process is really easy for them. They can get an approval very quickly, and literally, many times it'll take us longer to talk about it than it will be to do the actual treatment for them.
What can a patient do to prepare themselves for the procedure? Is there any
Well,
homework?
Is there any homework? Yeah, I love it when patients bring in pictures of
Okay.
what they looked like before. And we may not get them all the way back to where that picture's at, but it just gives me a guideline to say this is where they're shaped, this is the volume that they had. That's something that really helps us. It's really, we kind of break it down into if you want to see the result quickly, the fillers are the best thing that we can do for you. So if someone says, I'm going on vacation in 3 weeks, well, we might talk about skincare, and we might talk about Latisse, and we might talk about tightening their skin, but the fillers are really what's going to give us that result. And literally, I can take their picture, I can treat half of them and take a picture, and then I can finish the other side and just right on my iPad show them the difference there.
Wow.
Yeah. So, and I never get tired of seeing it.
I
I get to
wouldn't
see it
either.
many times a day, and I never get tired of seeing that.
I don't blame you. So how exactly is the procedure performed?
So the procedure, so the first step, like I said, is pictures. The next is we kind of map out a
Okay.
plan for the patient. And then based on the areas that we want to treat, so if we're going to treat the cheeks, we're going to need a stronger product because we're trying to lift that cheek up. We're
Right.
trying to shape and contour that. If we're trying to treat an under eye, we're going to need a soft product. So the softer product will have like a honey type consistency.
Okay.
The thicker one will be like a gel or a jelly.
Interesting, okay.
The products, they're soft and they're smooth and they're natural. Okay. And if you put them in the right amount, you're going to get a right result there. The products have numbing medicine in them to make them more comfortable.
Okay.
So for most patients, we just ice the area to kind of numb the area. And then it's just a couple little picks in each area. So
And that's it.
That's it. So that's pretty quick, pretty easy. There are some times we use an instrument called a cannula if we can't get there safely with a needle, if there's a lot of blood vessels in an area. We use an instrument called a micro cannula, and it's very tiny, and we just make a little numbing and a little needle pick in the skin, and we use that to reach underneath the skin. That's how I build out the jaw lines with that, or if I'm really shaping and contouring someone's cheekbones.
You kind of touched on this earlier, but about how long do the results usually last?
So depending on the product, depending on the area, so our goal is not to get you to, so if we treated you, our goal is not to get you to happy and say, come back when you're unhappy. Okay?
Right.
So if we did a package of like the 6, okay? So the goal is never to have that patient need 6 ever again.
Gotcha.
The goal is that they come in when they need 1 or 2.
I see.
Little touches along the way.
Okay.
They do those little touches. We maintain this. People will say, you're getting better with age. You're like fine wine. You don't age. And that's our goal. You know, we want to keep it normal and natural. We want to maintain it. If they just, you know, I literally I had a patient that one day come in. She goes, that stuff didn't last. She goes, it was gone in 6 months. So I'm looking at my pictures of her, and I said, can I take a picture of you? She's like, sure. I take a picture of her. I put them up side by side. And on my iPad, I was like, is it really gone? And she's like, no.
Nope.
No, it's not gone. So even though in her mind it was totally gone, it wasn't.
We're so hard on ourselves.
Well, they've done a lot of studies with this, and the average, it takes 4.5 days to forget what we look like.
Really?
And, yeah.
Interesting.
And so I believe that, because even though I'm in the field, I was telling you I had fillers done, it only took me 5 days to forget.
Really?
Yeah. So first 3 days, I'm really happy. Day 5, I get up for work. I'm in the bathroom mirror. I look in the mirror. It's like, I need more. It's like I literally had to go to the office and pull up my pictures. It's like, no, I didn't need more. It's like, it's very normal, very natural, but I forgot. Yeah.
You look great.
And so, well, thank you. So pretty much any treatment that we offer, if I can possibly have it done, I've had it done before it gets to you.
Really?
Absolutely.
Is that like you're the experimental process, or is it something that you like to personally say, I've done this?
I can give a personal perspective
That's
to say,
wonderful.
I've had it done. This is my experience with it. Absolutely.
You must really trust your team then. You know,
Absolutely.
You got a good group.
Got a great team.
You've definitely inspired me, and I can tell that you love to teach and you're very creative. So I have to ask you, when you go to work every single day, is it art or is it science?
Well, I'd say it's 90% art, 10% science.
Okay.
Yeah. I mean, you have to have the science behind the equipment or the procedures or what you're working with. So understanding that side is important, the science. But really what I do is art. You know, whether it's face art or body art, it's art. Yeah. And having that artistic hand or that artistic vision is really the big part of it. Yes.
All right. Well, thank
Yeah.
you so much for your time. We appreciate it.
Thank you.
We learned a lot about hyaluronic acid from one of the country's leading board-certified dermatologists. If you are considering this treatment, we hope we've provided the information you need to decide if you want to take the next step and schedule a consultation. All the healthcare experts featured recommend and accept the CareCredit credit card. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Freina with CareCredit, and I will see you soon.
Through October 31st, 2022, earn an entry for your chance to win $2,000 in the Let's Get Digital Sweepstakes. Enter the secret word facial in the Sweepstakes Hub to earn one entry now. Head over to the Sweepstakes Hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States and U.S. territories, including D.C., 18 years of age or older, who have a CareCredit credit card as of 9/6/2022. Void where prohibited. Promotion starts 9/7/2022 and ends 10/31/2022. Sweepstakes prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020.